Epidural Catheter Insertion Techniques. Today, we are going to cover a core topic in regional anesthesia, epidural catheters insertion technique. Hello everyone, I am Dr. Azam, Academic Head, Consultant Anesthesiologist and Critical Care Specialist at Bhagwan Mahavir Jain Hospital. So let's move step by step, starting from the skin preparation to all the way to the different techniques. We begin with the skin preparation. That is, chlorhexidine is the agent of choice with the skin when it comes to the skin preparation. It is bactericidal and prevents the transmigration of the bacteria for up to 24 hours after use. Chlorhexidine is available in two concentrations, 0.5% and 2%. But here is the key. Do not use 2% because it is considered neurotoxic. So the sequence is, how we use this is, first paint the back with chlorhexidine, then continue with your trolley preparation. What do the guidelines says? In the US, it is recommended to use 2% chlorhexidine, and in the UK and Europe, 0.5% is preferred. And finally, remember, we have 10% iodine as well, which is roughly equivalent to 0.5% chlorhexidine and is also effective. So next, when it comes to local anesthesia infiltration, we typically infiltrate the skin and the deeper tissues with local anesthetic solution before introducing the 2E needle. Make sure you cause a proper skin bleb. The local anesthetic is known to cause stinging action, so you can mix 0.5 ml of sodium bicarbonate to your 2% lignocaine to prevent this stinging action when you're injecting local anesthesia or local infiltration. Now let us look at the different techniques used to identify the epidural space. So we have three main techniques. That is, we have loss of resistance to air, loss of resistance to saline, and loss of resistance to tactile feedback. Now, loss of resistance to air. The studies suggest that air is less reliable for locating the epidural space. It is linked with higher incidence of incomplete blocks, risk of pneumocephalus, which can lead to headaches, and in very rare cases, venous air embolism also is seen. So, coming to the loss of resistance to saline technique. This technique involves gentle continuous pressure using saline in the syringe while advancing with the 2E needle, which acts as a single unit until we feel the sudden giveaway indicating entry into the epidural space. Then comes to the loss of resistance to tactile feedback. This technique relies on the feel of the tissues giving way, something that experienced hands can detect without air or saline. And finally, we come to a technique called as continuous saline push. Once we identify the epidural space, we load the catheter with the saline and connect the syringe filled with saline at the crocodile and start flushing the epidural catheter with saline. Now, this technique is evolved when we are pushing the catheter inside. It helps to hydrodissect the space and helps in moving the venous plexuses away. So, from skin preparation to the loss of resistance techniques, this is the foundation for the safe and successful epidural block. Thank you for tuning in. Happy learning and keep practicing safe anesthesia. Thank you so much.